A Disabled People Love Sex Guide. Disabled People Love Sex Guide Introduction. This book helps people with mental and physical disabilities and a number of chronic illnesses deal with love and sex in a mature way. Everyone has certain desires and needs. We have to deal with them the best way possible with what we got. Chapter 1. Sex and Disability or Illness. Sex and Disabilities/Illness 1. A disability scares the hell out of most people, so it's up to the disabled person to make the non-disabled one feel comfortable. Disabled guy. The greatest disability is a closed mind. Blind guy thankful he isn't an asshole. How do you define sex? Some people say sex is 90% in the brain, so regardless of disability, if you still got a brain, you still got sexual ability. Disabled people just have to be more creative in exercising their sexuality. They say men who can't get an erection can still get horny and even orgasms. Some disabled men say using a vibrator or another masturbation machine will bring them to orgasm, which has a twofold purpose: for pleasure and to gather up enough sperm for artificial insemination. Many physical conditions could impose limitations on a couple to prevent a normal sexual relationship. There are injuries, deformities, and recuperations from surgeries. Two partners who love each other have to use the situation to develop new, creative ways to provide sexual satisfaction for each other. Learning these techniques together could be good for the marriage as husband and wife grow together after the mishap. Try to stay intimate. Often after a dramatic illness, there is a period of a lack of sexual desire, often due to depression. This can be tough on the couple. In general, an improvement in health equals an improvement in sex drive. Even paralyzed people can engage in sex with the tongue. Many men and women alike, after they get an illness and are older, like about 55 plus years old, simply give up on sex even if theoretically, then can engage again. It's up to them. Use it or lose it. Sexability is a term I've seen bandied around regarding disabled people and their need for an expression of their sexuality. It's a workshop for disabled people offered at various places throughout North America. Participants, mostly people with a mobility disability, meet once a month to discuss sex-related topics. The Planned Parent Federation, PlannedParenthood.org, PPFA.org, PPFC.ca, Canada, is involved with this program. Just because anyone is disabled doesn't mean they can't have sex or don't think about it. The sexuality is still there. In some cases, the tools might be damaged, but the brain still releases neurotransmitters and hormones that relate to sex drive, so the thoughts are still there even if the penis or vagina have been damaged in some way. The Sex for Disabled People advocates say, be yourself. Develop a lifestyle to feel good about yourself. Have fun. These are all positive signs that you're approachable and will help lead to social encounters and eventually a healthy relationship if that's what you want, but there are no guarantees in love for anyone, disabled or not. People without disabilities generally have misconceptions about disabled people and sex, such as: people with a disability don't think about sex. They don't have sex much. If they do, their babies will be born with a disability. The big issue is the general segregation between non-disabled and disabled people in life in general. So-called normals feel self-conscious around disabled people, so generally stay away, which is why the disabled individual has to take initiative and make normals feel comfortable around him or her. And if you're interested in sex and/or a relationship, you have to put out the cues that you're fair game. Sex doesn't have to be intercourse. It's whatever works at the time between the players involved. Remember two key concepts. The brain is the major sex organ. The largest sex organ is the skin. You have to rediscover your body and do what works. It can be difficult at first. You have to work around the disability to enjoy a healthy sexual life. Sexuality is a part of everyone's life force regardless of how distorted or disabled their bodies are. Minimize the effects of the disability on the libido. There doesn't have to be a taboo about it, as there currently is. A major problem of some disabled people is to get the privacy to explore their sexuality. People who receive attendant care are unable to do some things for themselves. It's very difficult to get romantic with someone when you need an attendant to lift you up and put you in bed. A disability can be a two-pronged deal regarding sexuality. For people who enjoyed sex before the illness or injury, it will be a nuisance and they'll have to find ways around it to enjoy their sexuality. For others, the disability or illness is a great excuse to stop engaging in sex with their spouses. Often, people who are very sick become more open to new possibilities in life, and one of the facets of this is an increased interest in sex and intimacy. At the least, sick people often want to touch and connect more with others on a deeper level. When you're sick, you often realize it could be your last chance to enjoy your life, so if you're going to do it, you must be able to muster your determination to keep going no matter what. Sexuality helps people feel better and could help them heal. There will be limits and a time for adjustments, but it's worth it to try for sex rather than let it go. Disabled people are as horny as anyone else. They want love and romance too. Many have children. The worst thing for disabled people is to be pitted or treated as less than full human beings. Respect them enough to treat them like you treat everybody else and accept them for who they are. Disabled people in general say they're treated like wallpaper everywhere they go. People would rather ignore them than force a conversation because they assume the person is morbid, serious, feeling sorry for himself with a chip on his shoulder against the world, but it's not necessarily true. Some disabled people try to shut themselves away from society, but many don't. They're mature enough to accept themselves as is and proceed on from there, trying to live normal lives, earning a paycheck and finding someone to love who loves them back. Don't give them pity, just a chance to show they can be good, genuine, loving, happy human beings. The fact is that no matter how lovable and cheerful any disabled person is, he or she will still get rejection and stares wherever they go. Sex is a very sensitive subject, as is, so if you add a disability and sexual functioning problems on top of it, you know how it is to deal with it. The goal is for the person with the disability/disease and his or her sexual partner to work together as a team. Adjusting to changes is an important part of coping with the illness. Make it a point to understand why sexual changes are happening, to know what to expect and to know what you can do to deal with or adjust to those changes. Sexual problems with most disabilities have physical causes, emotional causes, or both. Even with physical problems, people can still find some manner of feelings of pleasure. Changes in the way a man or woman feels about their attractiveness can have an effect on sexual ability. Talk over feelings or concerns. It is important for the afflicted person to discuss any fears or questions with his or her sexual partner. Talking about sexual matters with a close friend or medical professional can also help. Plan periods of time for intimacy when you will not be interrupted. Privacy is important for relaxation and sexual pleasure. Some pleasure comes from touching and being held. Sexual intimacy can be achieved without intercourse, without orgasms, and without erections or ejaculations, simply by holding, touching and kissing. Touch brings comfort and security. For the lovers of disabled people, especially if they're not disabled themselves, they get a lot of feedback from friends, family, and acquaintances about what a tough life they'll have, how it's better to split and cut their losses. The families of the disabled one try to discourage relationships with non-disabled people because they're afraid the person leave at some point in time and the disabled one will be devastated. On the other hand, some normal people prefer disabled people because they've been hurt before and feel that a disabled person would be more sincere and loving, have a mothering complex to mother someone not as independent as they are, feel that they will get that dependency type commitment they really want, see themselves as saviors, or simply have a fetish for this type of person. It could also be that two people, a disabled and non-disabled one, fall in love like normal people do, being irresistibly attracted to the spiritual essences/vibe and looks of each other. Sex and disabilities/illness too. Don't act like your disability is a big sullen tragedy. Be positive, put your best foot forward, act like it's just a minor nuisance rather than a full-fledged impediment. Disabled guy. Having a disability means that if you want sex relations, you have to talk about it and be upfront about what works for you and what doesn't. Be creative about the things you do to get off either by yourself or with a lover. As a disabled person, you can put up ads where normals want to date disabled people. If you have a disability or poor health, you have to accept yourself, get over it and do the best you can trying to enjoy your life and sex because it's still your birthright. You almost never see disabled people have sex, make love, or talk about it in the mainstream media. People of all abilities have sex drives. They are entitled to sexual fullness like anybody. People with disabilities are often desexualized by doctors, caregivers, friends, family, and in many cases themselves. Most disabled people can still have sexual intercourse even though you don't have to have intercourse to enjoy sex. You can have oral sex, hand jobs, kiss, hug, etc. You might not be as physically attractive as you like, but you should be a more sensitive person seeing as you understand people's feelings, since people are always hurting yours by treating your disability like a contagious disease. You have to feel worthy, attractive, and entitled to your sexual birthright. Both men and women with spinal cord injuries can have a sexual life. The extent of orgasm will depend on the nature and extent of the injury. They should empty their bowels and bladder before sex, and the woman should use a lubricant for her vagina. Women can get pregnant, so they should use birth control devices if they don't want to conceive. Contrary to the popular myth, disabled people aren't sexless. They're as sexual as anyone else, sometimes more so because of the frustration of the challenges they have. The medical and rehabilitation industries don't help much either. They prefer not to talk about it nor provide patients with the education or products to help them attain some sexual satisfaction after their disabilities hit. The rules for attracting a partner are the same as for anyone else. Often disabled people pair off with other disabled people, but there are plenty of disabled people who pair off with a normal person even after they're disabled because they've got the charisma and tenderness to attract these people. Some disabled people I've read about say they find people who accept them as they are never critical of their disability, and never apologetic or embarrassed about their partner when meeting new people for the first time. I suppose this is what everybody wants, a loving, supportive partner. The rules are simple, basically the same as for non-disabled people. Don't shut yourself away or be bitter. Get out into the community and do normal things. Don't focus on finding a lover, focus on being a pleasant person and a friend first, and if you're true to this, the romance will follow in time. Try dating services, both disabled and non-disabled ones. In general, non-disabled women are more likely to pair off with disabled men than non-disabled men with disabled women, but it's not laid in stone. I've read several accounts of both types of relationships, so no matter what, it's not impossible if you're a genuinely nice person. Non-disabled people in general are uncertain as to how to socialize with a disabled person. Do you ignore the disability or initiate conversation about it? Perhaps the best way is for the disabled person to initiate conversation about it after he or she develops some kind of rapport with the other. Ask questions like, "Would you like to know how I got this way? Would you like to more about my disability? Does my disability bother you? Do you feel self-conscious about the way other people perceive me? Do you wonder how I feel about being like this?" Don't focus on the disability, but be ready to talk about it when the subject comes up, either by you or them, because some nice people will initiate questions in an attempt to be open-minded about it. It takes courage to go out into the world and circulate, risking rejection by many people out there, but if two people find each other and fall in love, the disability really doesn't matter all that much, but you'll never know if you just stick with your own kind and not try to relate with all the many non-disabled people out there. Most doctors don't know much about sex and disabilities and may be embarrassed to talk about it. If you need help, either find a doctor in the field of your disability who specializes in sexuality or find a general sexual counselor. One book I read said you have to be the eternal optimist just to deal with the rejection because there's so much of it out there. You can find positive power type books generally from number 100 to number 199 at the library, particularly hashtag 155 to number 158, number 248, religious inspirational books, and number 291, spiritual type books. Medical books go from hashtag 610-619 at the library. I read about a quadriplegic man who said he had great sex with his normal wife. The 1978 movie Coming Home is about a disabled Vietnam vet and the relationship he gets into with a normal woman. The movie Born on the 4th of July is about the anger a wheelchair-bound Vietnam vet feels. Life for disabled people is harder than it is for the normal person, so you'd think that you could use some of that tenaciousness to think up creative ways to meet somebody and have sex with them. The Dutch government pays for disabled men to have sex with prostitutes and calls it therapy. Sex and disability one-liners. Disabled people are horny, but it against the law to do inappropriate things like fondle a stranger woman's breasts. Men in wheelchairs say they're at the height of a woman's breasts and genitals all day long. If a guy is paralyzed and can't feel his penis, there are other signs of arousal like erect nipples, heavier breathing, increased heart rate, etc. A reflex erection is when the penis of a paralyzed man gets hard in response to touch even though he can't feel it. Some paralyzed men can get hard and come when the penis is handled. Paralyzed women's vaginas excrete less lubrication, so they could use a store-bought lube when engaging in sexual intercourse. Paralyzed women say they get orgasms quite easily because it's in the head. Disabled people use sex toys to get off. Some disabled people retrain themselves to get a mental-emotional orgasm rather than a physical one. Most disabled women can get pregnant. Sperm can be extracted from most men for artificial conception. Many people with disabilities still manage to try for sex and have great sex. You have to create your own opportunities and your own newly revised sex life. You have to make do, try new positions, new gadgets, new toys, new body parts, new techniques. Oral sex works well. If you can't have full-blown sexual contact, you can always cuddle and talk gently. The truth is that most disabled people can have sexual intercourse and sexual orgasm. Of those that can't, many report psychic-type orgasms where memories from past orgasms before the disability flood their brains and they get the sensations throughout their bodies. Other people say they enjoy the kissing, hugging, cuddling, and intimacy part. Most rehabilitation centers have someone on staff that can help you with such matters, giving you information about how to get along in your new sex life, but you have to ask about it. Simply contact the nearest rehabilitation center or physical medicine and rehabilitation department in any major hospital and ask for help in how to have sexual relations with your disability. Some disabled people can have orgasms through what is called sensory amplification. If you're paralyzed, you can transfer the sensual feelings from your sex organs to a part of your body that has sensations. Think about it, focus on it, play with it and massage it, and over time, stimulating that part of the body might give you pleasurable sexual sensations. There's a lot of info out there about having sex while disabled and where to meet other disabled people to find love. If you can't find a partner, there are plenty of masturbation devices to give you a healthy sex life. There's even the Sybian machine, which is hands-free masturbation for men. The guy who started sexualhealth.com, Mitch Tepper, who I saw on Sex TV, had a diving accident at 20 which severed his spinal cord. He's now promoting sexual ability rather than disability. He's redefining the orgasm. Whereas the sex organ is connected to the brain via the spinal cord, in a spinal cord break, the brain gets the sexual message of arousal and sends a signal to the body as a whole, so he said he feels the orgasm through his whole body, especially the chest. He was also able to conceive a baby by using a vibrator to stimulate the penis, then collecting the ejaculation in a cup which was then artificially placed into his wife. Doctors can do this too by reaching down into the penis to extract some of the sperm a male naturally produces all the time. Try typing the term paraplegic and pregnancy into search engines. Studies on paraplegic people, especially women, found that not all sexual sensations go from the sex organs to the spinal cord to the brain and from the brain through the spinal cord to the sex organ. Some go directly from the sex organ to the brain via the vagus nerve near the cervix, which is at the end of the vagina and the entryway to the womb, so this is why paraplegics still feel sexual sensations even though their spinal cords have been severed. Other peripheral nerves may carry some of this message too. The most universal suggestion for couples where one has any type of illness or disability is to experiment to find what works position-wise. Do it in a hot tub, use pillows and a waterbed, time of day you feel the best, what medications to take that won't interfere with sexual virility, and look at the many sexual aids and sexual furniture out there that might help you. Mood-changing substances like booze might loosen you up enough to enjoy sex for a little while. In general, normal people without disabilities have a mental block where they see all people with disabilities as non-sexual beings. Of course, this isn't true. They're sexual beings who happen to be disabled. It's wrong to suggest that disabled girls, either mental or physical, get hysterectomies or other procedures like tubal ligation to avoid unwanted pregnancies and the problems of menstruation. They still have rights and know what's going on even if you think they don't, so tread lightly before you act. Get advice from the support group of the particular disability and go to siecause.org. Masturbation is not something to be guilty of. Use sex toys such as those advertised at xnria.com or make some of your own, like the girl who used her cane as a dildo. There are fertility clinics which can extract semen out of some disabled men who can't have sex and implant it into their female lovers who want their children. Holland has a program called SAR funded by the government where sex workers, prostitutes, go to disabled people's home to satisfy them sexually. There are specialists around who deal with pregnancy and conception for disabled women, but you have to find them by asking around at infertility clinics, urology departments, and rehabilitation hospitals. Sex will involve some compromises, but if you're disabled, you've already learned to be resourceful, so just continue it on into the sexual realm. Remember, sex isn't just intercourse or orgasms. Be romantic, touch skin to skin, kiss, hug, etc. Often, disabled people develop heightened abilities in other aspects of their lives. Continue to be wary of the dangers of STDs and take the appropriate actions when and as required. If you can't live independently and either need an attendant or have to live in a facility, keep a middle-of-the-road approach with the attendant. I've read that they help some of the guys before dates by cleaning them and positioning them in the bed for their girlfriends, but other people say when they're entertaining, they simply tell the attendant to leave for a while. In general, the gay community is pretty accepting of gay disabled people, probably because they understand what it's like to be a minority. Most of the medical service organizations regarding a specific condition like the American Paralysis Association will have a publication or information about sex and the condition. Britain has an association to aid the sexual and personal relationships of people with a disability/SPOD. Try to find it on a search engine. Sex and serious or chronic illness. If you have a serious illness, sex doesn't really matter. It's about your life. People who have a serious or chronic illness probably feel tired a lot of the time. They may be in pain, on medicines, and having treatments that can affect their sex life. They may have a surgery that changes how their body looks. You might be worried about dying. Learn about your illness and how to maximize healing. Try #610-619 at the library. Plan sexual activity for the time of day when you feel the best. Limit the amount of alcohol you drink. It's a depressant. Focus on non-intercourse sex like tantric sex people do. Be romantic, touch, kiss, etc. with no expectation of intercourse. Tell your partner what you like and do not like. Listen to your partner's likes and dislikes. Try different things and sexual positions. Talk to your lover about it. Use sex toys. Talk to your doctor. If you're a man, he can prescribe a sex pill. Love and disability info. The marital vows say in sickness and health. I wonder if anyone has ever done a study to see how many spouses bail after their spouse is diagnosed with a serious disease. Quest.mda.org/article/sickness-health-and-love Sex toys and disabled people/disability sex toys. Some people say sex toys were first invented by doctors specifically for disabled people. In 1971, Gosnell Duncan made medical-grade silicone sex toys for people in the disabled community. If you buy a sex toy, you might have to adapt it to serve you. There are butt plugs or the egg vibrator that you stick into an orifice. You prop fleshlights against an immovable object. Anero's toys are prostate massagers that work as you squeeze your PC muscles. There's a vibe panty you wear to vibrate the clit controlled by a remote control. There is a vibrating cock ring. Try different toys. Invent one if you got the inspiration. I invented one. I couldn't find an investor for it. I've examined a lot of sex toys. My final analysis is that there still are not great hands-free sex toys out there that you can turn on and off and vary the intensity with a remote control. The big sex toy, at least for men, doesn't exist right now. Go to advancedmasturbattion.com and read about guys saying they bought particular sex toys but abandoned them because they didn't do the job good enough. Those sex swings can help put you in a position to have sex. Disability sex toy websites. equalitytechnology.org/adaptive_devices.htm. zensual.net, sex toys for disabled people. disaboom.com/sexuality-and-disability. sexualhealth.com/channel/view/disability-illness. intimatereider.com, helps with sex for disabled people. mypleasure.com. thestockroom.com. Zandra Disability Catalog. 165 Valley Drive, Brisbane, California 94005. 800-242-2823. xenria.com. Adult Products. Chapter 2. Love and Sex for Mentally Challenged People. Sex and Mental Disabilities. Just because someone is mentally impaired doesn't mean they don't have sexual feelings. This is especially hard on the parents of mentally impaired children when they're approaching adolescence. If they just have a mild disability, they'll be socially educated enough to keep it to themselves, but some can't control it and will grab at people they might be interested in sexually. Don't ignore their sexual development. Don't protect them from what's naturally happening to them. Talk to them, educate them about it. Give them privacy and allow them to masturbate. Tell them it's alright to do so, just do it in private away from other people. You'll have to teach a girl about menstruation. Just because mentally impaired people are slow intellectually, it doesn't mean they don't want to love somebody special. Sexually, they develop as normal adults. Some have romances, marry, and have children, often with other mentally disabled people since they're in contact with them through schools, group homes, the Special Olympics, etc. Some people are afraid that moderately mentally retarded boys approaching puberty may get sexually aggressive and do forbidden things, but the experts say give them sex education courses just like normal kids and they'll turn out fine. If you have a mentally impaired child, try to get him or her involved with other people socially, both normal and mentally impaired. The group of mentally retarded people I knew from my teenage days when I lived less than 200 yards from a Flowers of Hope Center, a day school for mentally retarded adults, were all only too aware of sex as evident by their teasing amongst each other about who liked who, etc. They watch TV like everyone else. Most of the mildly retarded ones know a lot about love and sex. If your child is in a group home or in an institution, make sure he or she gets enough privacy so they can masturbate in peace. Many group homes overlook this fact of life and put either two people in a bedroom or put them in a dorm-like setting. This is wrong. Everybody needs some privacy. As far as I know, it's illegal and unethical to force a tubal ligation, hysterectomy, vasectomy, or castration on a mentally disabled child. Even the parents can't force a child to be sterilized. Try the book Doubly Silenced: Sexuality, Sexual Abuse, and People with Developmental Disabilities by Patricia Patterson. There is a book called Sexuality: Your Sons and Daughters with Intellectual Disabilities by Melberg Schweier and Paul H. Hingsberger. Love and mental disabilities. People need people. It doesn't matter what so-called disability you might have. It doesn't matter if you're intellectually impaired. Some of these people couple, some don't. Most can be educated about the basics of sex and love, that masturbation feels good and is fine to do as long as you do it in private. The rules for romance apply the same as with any couple. People find each other, someone who gives them a tingly feeling and they can relate to. Mentally retarded people have just as much rights to a normal, happily married life as anyone. Nobody can legal force them to get a tubal ligation or a vasectomy. They have the right to have children. They have the same problems as other people, namely lack of money. Talk to them openly. Let them speak, listen to them. Don't live their lives for them. Don't tell them not to get married. Don't keep them from going out because you're afraid they'll get used and their hearts broken. They have to live their own lives, make their own decisions. Intellectual impairment basically is a term meaning you don't score high in tests that the few academic subjects in grade school cover. It doesn't mean you don't have street smarts or emotional smarts. Most intellectually challenged people know what's going on people-wise. Don't shield them from their sexuality or feelings of attraction. Books about mental retarded are at hashtag 362.3 at the library. There are a few books about love and mental retardation around. I found one at hashtag 306.7087 or HQ 1041 at the library. Another one is Couples with Intellectual Difficulties Talk About Living and Loving by Karen Melberg-Scavir. Sex and Autism / Love and Autism. Adderworld.com. ADHDmarriage.com. AdultADHDrelationships.blogspot.com. albany.edu/aging/IDD/documents/parentworkbook.pdf, Sex Ed for Children and Teens with Developmental Disabilities. Disabilitiescoop.com, Dating and Relationships for People with Learning and Developmental Disabilities. embodiedzesuality.blogspot.com/search/label/ad. maxineaston.co.uk/published/as_in_the_bedroom.shtml, Asperger syndrome in the bedroom. nakedbeerinc.com, Sexuality and the Autism Spectrum. nakedbeerinc.com/resources. sexsupport.org. Love and Sex for Mentally Challenged websites. Books are at hashtag 301.427, 362.371, 371.9 and 616.8589 or LC 4704 at the library. siecus.org/pub/biblio/bibs0009.html, teaching persons with mental retardation about sexuality and love. acl.on.ca. betterhealth.vic.gov.au/bhcv2/bhc articles.nsf/pages/sex_education_for_disabilities ? Sex Education for Children with Intellectual Disabilities. centerforpublicrep.org/page/69466, Mental Health Law, Sex in Mental Institutions. challengingbehavior.org.uk/cbf-resources/information-sheet/difficult-sex-ual-behavior.html, difficult sexual behavior amongst men and boys with learning disabilities. cqc.state.ny.us/councils_corner/cc32.htm, The Law, Sex, and Mental Disabilities. downsyndrome.com. education.com/question/mentally-challenged-friend-sex. en.wikipedia.org/wiki/the_abc_of_sex_education_for_trainables. ericec.org/faq/sex-ed.html, Students with Disabilities and Sex Education. etr.org/recap/p/research/journal200110.htm, Sex Education Programs for People with Mental Retardation. med.umich.edu/1libar/yourchild/disabsx.htm mentalhealth.samhsa.gov/publication/all-pub/SMA05-3982/default.asp mentalhelp.net mncdd.org/learning/text/gt034.text prevent harm to children with learning disabilities pdassociation.com/ssse.html social skills and sex education romanceinstitute.com/lvshop/ACIN search_B0008J2HCM, educating students with mild mental retardation. STEdgepublications.com, Stige Publications provides information, consultation services, and training opportunities to enable staff and parents to promote healthy sexuality among adults with mental retardation. thearc.org/faq/sexualabuse.doc thenad.org/content/products/description/CT99-102b.htm, an association for persons with developmental disabilities and mental health needs. uscm.med.sc.edu/cdr/sexualeducation.htm, sex education and social skills training for persons with developmental disabilities. American Association on Mental Retardation. 1719, Colorama Road. NW. Washington, D.C. 20009. 800-424-3688. 202-387-2193. Fax, 202-387-2193. aamr.org. All-around support group providing referrals, resources, and treatment. The Stige Corporation. 5410 Fredericksburg Road #111. San Antonio, Texas 78229. STEdgepublications.com. Woodbine House. 6510 Bells Mill Road. Bethesda, Maryland 20817-1636. 800-843-7323. woodbinehouse.com. Chapter 3. A Sex and Illness Guide. My lover has mental illness. Should you stay with someone who is really messed up? How much is just plain weakness or nastiness like an angry person versus how much is beyond their control? Does your lover need love or is he or she just an asshole? fmhi.ca/index.php/support-article/53-someone-you-love-has-a-mental-illness. psychcentral.com/blog/archive/2010-03/08/5-tips-if-you-love-someone-with-mental-illness. wayneantamara.com/whensomeoneyouLove.htm, When Someone You Love Has a Mental Illness by Rebecca Woolies. Sex and illness info. Sick people usually have no interest in having sex, but some injured people have more interest in sex. Consider an athlete who gets injured. Now he or she has to lay in bed with no outlet for their energy. I read an article that said having sex can help you keep from getting the common illnesses like the cold and flu. All sickness, according to Ayurveda, is the result of toxins in the body. Drink fresh juice and water to heal oneself. Sex injuries/injuries from sex. Men can bruise their penises. Lovers can bite each other too hard, but there are many other injuries people can get through sex. A lot of people pull muscles during ordinary sex. aaos.org/research/stat/home_neck_sex.asp, home injuries to the neck by sex. abcnews.go.com/health/sex/sex-related-injuries-common, sex-related injuries more common than you think. After neck snap duri ng sex act. Answers.yahoo.com, neck pain and sex. blogcatalog.com/discuss/entry/sex-related-injuries. goascalis.columbia.edu/0627.html, sex and spinal cord injuries. HuffingtonPost.com/2011/10/1/sex-horrifying-sex-injuries_n_106894.html. Sexualhealth.com/sex-and-injury-disabilities-chronic-conditions. Spine-health.com/forum/neck-pain-cervical/sex-and-cervical-spine. Thefrisky.com/tag/health. Sex and Alzheimer's. Dementia causes many changes in people's lives, including changes in sex and intimate relationships. Chances are that your Alzheimer's spouse will cycle in and out of knowing you. Some people say that even though they have dementia and lose their minds, their soul still remembers. Where science stops, God starts. Some people say that their Alzheimer's spouses still remember the love and intimacy from the relationship. Sexual urges don't stop just because Alzheimer's or another dementing illness invades the brain. There could be inappropriate sexual behavior related with Alzheimer's disease. Some people get hypersexual. Alzheimer's patients can start doing inappropriate sexual things like take their clothes off in public, masturbate openly, fondle other people at random, etc. alz.org/library/download/sex-and-intimacy_rl2010.pdf. alzforum.org. alzheimer's.org.za/about-lz/caring/behave/sex_dim. alzheimersreadingroom.com. thirdage.com/alzheimer's. Sex and arthritis. There are ways to have sex with arthritis. There are sex machines for men and women that do it for you. With arthritis, you can still be massaged and possibly give massages. ahealthyme.com/topic/arthsex. goascalus.columbia.edu/2868.html. seniorjournal.com/news/health/03-30-01 sexarthritis.htm. sex-fitness.com/sex_what_do_when_real_stiffness_begins_for-your_sex_life.htm. Sex and brain injury. betterhealth.vic.gov.au/bhcv2/bhc articles.nsf/pages/traumatic_brain_and_sexual_issues. sexsupport.org/tbi.html. Sex and cancer. Cancer is not contagious during sexual relations unless the guy has the human papillomavirus/HPV. Semen doesn't transfer cancerous cells. Cancer treatments may affect sexual desire. Radiation and chemotherapy make patients tired and sick. There is a book called Breast Cancer Husband by Mark Silver which tells you to respect your wife and try to make her feel beautiful even if she loses her breasts to surgery. There is a book called Vaginal Recuperation After Cancer or Surgery. carepages.com/cancer/head-neck-cancer-and-sex.html. advancesinhealth.com/prostate/prostate-cancer-sex.html. cancer.org/docrude/mit/content/how_7_3x_how_will_cancer_affect_my_sex_life.asp. How will cancer affect my sex life? breastcancer.org/intimacy_arrowusal.html. breastcancer.org/women_sex_after_cancer.html. cancer.gov/cancer topics/pdq/supportive care/sexual/ity/health professional/page 5. cancer.org/docrude/mit/content/mit_ways_of_dealing_with_sexual_criteria=MIT. cancerbacup.org.uk/info/sexuality. cancerbacup.org.uk/question/living/living-sexuality. cancerlinx.com/sexuality, cancersupportivecare.com/sexuality, cancersurvivors.org/coping/physical/sex.htm, cancersemptoms.org/sexualdysfunction/index.shtml, webmd.com/content/article/53/61309.htm, sex after breast cancer. American Cancer Society. 1599, Clifton Road, N.A., Atlanta, Georgia, 30329. 800 ACS 2345. 800-227-2345. 404-329-5787. Fax, 404-329-5787. Cancer.org. Free booklet Sexuality and Cancer. Sex and Cerebral Palsy. Sexualhealth.com, Possible effects of cerebral palsy or CP on a person's sexuality. Sex and depression. webmd.com/balance/features/what-happened-sex-life. Books about depression are at hashtag 616.8527, hashtag 616.8950 or RC516-537 at the library. Depression-web.com. copewithlife.com. indepression.com. depression-help-treatment.com. Sex and diabetes. Diabetes is not sex-friendly. People say take your blood sugar levels before and after sex. Somebody asked if swallowing sperm as in oral sex will affect your blood sugar level. Sex is exercise. Exercise is good in the fight against diabetes. Keep some candy nearby in case you need a quick shot of sugar. Wear a medical ID if you're out cruising for sex. Don't skip your insulin shots. lifestylemod.com/diabetes-effects-sex-life.html. diabetesmind.com. aaaq.com/kidney_urologic/sexual_urologic_problems_of_diabetes, diabetes, and sex. ahealthyme.com/topic/diabetes-men-sex. diabetes.ca/section_about/sexualdys.asp. diabetes.org.nz/about/sex-health-women.html. diabetes.org/for-parent-10-kids/living-with-diabetes/dating-zexpreg.jsp. diabeticlifestyle.com/article/mar00_what's_1.htm, women, and sexual dysfunction. lifeclinic.com/focus/diabetes/sex.asp. medicinenet.com/sexual_and_urologic_problems_of_diabetes/article.htm. netdoctor.co.uk/sex_relationships/facts/sex-diabetes.htm. webmd.com/solutions/diabetes_and_your_sex_life. Sex and epilepsy. apelepsy.com/article/AR_1064250527.html. apelepsy.org.uk/youngpeople/sex.html. apelepsyfoundation.org/answerplace/life/adults/women/professional/sexuality.cfm. apelepsyfoundation.org/answerplace/life/adults/yzex.cfm. apelepsytoronto.org/sex.html. mentalhealth.samhsa.gov. Sex and heart attacks. If you're high risk for a heart attack, sex could cause one. After a heart attack, the risk is generally over provided you don't fall into bad habits and weaken yourself such that you become high risk again. The doctors will fix you up, but then it's up to you to strengthen your body to avoid another heart attack. The general rule of thumb after a heart attack is if you can walk up 2 flights of stairs, you can have sex without worrying about overexpending yourself. If the patient was sexually vital prior to the illness, most doctors feel that resuming a healthy sex life will help with recovery. Scientists have monitored the heart rates of cardiac patients during sexual intercourse and found that the maximum heart rate response reached 120 beats per minute but was sustained for only 10 to 15 seconds, which is generally not strenuous enough to cause any difficulties for heart patients when engaging in sex. Simply relax before sex for an hour and relax afterwards as a precautionary measure. The general consensus is that a man can have sexual intercourse to climax about 6 to 8 weeks after a heart attack, provided normal healing has taken place. Just do it in a leisurely manner without putting stress on yourself. Some doctors recommend the cowgirl position for a while to take the pressure of the man. Typical symptoms of a heart attack include a crushing pain in the chest, sweating, difficulty breathing, weakness and pain in the arms, particularly the left. Symptoms one could attribute to something else can cause devastating delays in seeking treatment. Many people have heart attacks and don't know. They just feel a pain and keep going. These include feelings of indigestion, back, shoulder, neck pain and nausea. Early signs of trouble may appear during physical activity and disappear with rest. Any numbness of tingling of the fingers or toes, dizziness, shortness of breath or difficulty in breathing should not be ignored. A lot of people don't realize they've had a heart attack until they go to the doctor at some point in the future and he sees the damage to the heart caused by the previous heart attack. New drugs can stop or limit the damage of a heart attack, but only if the patient gets help immediately, experts say. Once the flow of blood to a portion of the heart is blocked for several hours, the damage is irreversible. Knowing the symptoms of a heart attack, which can be wide-ranging and confusing, is extremely important. So is knowing risk factors such as obesity, diabetes, high blood pressure and family history. Angina pectoris is defined by an insufficient supply of oxygen to the heart. It usually precedes a heart attack. It's almost always caused by atherosclerosis, clogging of the arteries by fatty substances. Clinical studies, laboratory investigations, and a number of surveys show certain personal characteristics and lifestyles point to increased danger of heart attack, coronary heart disease. The well-established risk factors are high blood pressure, high blood cholesterol, cigarette smoking, and diabetes mellitus. Other factors that may increase or affect the risk for heart attack are obesity, a sedentary lifestyle, an aggressive response to stress and certain drugs. Sex doesn't cause heart attacks. If you have a heart attack during sex, it just means that your heart was already so badly deteriorated by poor living that the sex was just the final factor to set off the inevitable. When you're in that state, any exertion could set off a heart attack, like shoveling snow or running to catch a bus. For regular heart patients and those with high blood pressure, unless the doctor explicitly tells you so, sex and masturbation shouldn't be a problem, both on your ability to do them or as a hazard to your health. They say it's the same as with regular physical activity: if you feel fine, keep it at. Sexual intercourse generally involves the exertion of walking up 2 flights of stairs, which is really not that intense relative to the limits of the physical body. If you find yourself getting breathless and dizzy, of course, stop and rest. Sometimes, a bit of rest will heal the problem, but if it persists, go to the doctor. If you feel too weak for sexual intercourse, you can still hug, snuggle, kiss, and do milder forms of sexual activity. There might be the occasional instance of intense sex causing a heart attack, but most of the time, you'll just stop, pant for a minute or two to get your breath back, and you'll be fine. The conventional rule of thumb is that if you don't get short of breath or experience chest pain when you climb 2 flights of stairs, you should have no problems having sex. After a heart attack, the heart muscle is injured, it needs time to heal. The doctors will probably unclog some of the arteries or create new blood passageways to the heart, which, when compounded with the effects of the heart healing itself, will give you a stronger heart, but you should wait until about 8 to 10 weeks after the heart attack, when it has healed sufficiently, in order to try sex again. Some people have sex as little as a week after a heart attack with no problems, but you might want to play it safe and wait a while. As long as you develop better lifestyle habits, your heart should get stronger and the sex better. Only the most extreme cases can't have sex anymore. Sexual intercourse burns about 5 calories a minute, which is not as strenuous as a light jog, so it shouldn't be too hard on you. Girl on top is slightly less taxing than the missionary position on the man, with oral sex being the least strenuous. With sexual intercourse, the heart rate goes up to 120 to 160 beats per minute, but only for a very short time. Some cardio patients have chest pains, which medically is called angina pectoris. Among people who experience this, the ones that have sex report less pain and less painful attacks, presumably because sex releases a lot of beneficial hormones like oxytocin and endorphins, which helps the person feel good and the body heal itself. Sexual ability is all about good blood flow. The fact that you've had a heart attack shows that you had bad blood flow to the heart, probably because you ate too much fatty food which clogged the heart arteries and didn't do enough physical activity to get the blood flowing to flush all the toxins out of your system and get practice flowing well throughout the body. So the solution is simple: eat healthy and do some kind of moderate to strenuous physical activity. People with permanent pacemakers, other than an adjustment period during the first 2 weeks, should be able to have regular sex. The aftereffects of a medical illness often reduce a patient's confidence. Most physical difficulties can be overcome with love and common sense if the couple work together. Massaging the body is good for circulation. Books about heart disease are at #616.12 at the library. dummies.com/wileycda/dummies article/id-717.html, Sex after a heart attack. ahealthyme.com/topic/hazex. americanheart.org/presenter.jhtml ?identifier =238. health24.com. mirror.co.uk/sexandhealth. myhealthwellmark.com/topic/hazex. news.harvard.edu/gazette/1996/05.09/sex after heartat.html. tihihialthopages.com/mpi/howsexbk.html. torranceMemorial.org/carsx.htm. American Heart Association. 7272 Greenville Avenue, Dallas, Texas 75231. 214-373-6300. 800-242-8721. 800 AHA USA 1. 800-527-6941. AmericanHeart.org. They offer many programs and pamphlets as well as a quit smoking program. Sex and hemorrhoids. You can have anal sex and other forms of sex while having hemorrhoids. If you feel pain, back off. Gently play in and around the anal sphincter with a finger. goaskalice.columbia.edu, hemorrhoids and anal sex okay. Sex and herpes. According to the information in these websites, you can have a healthy, safe sex life with herpes or with someone with herpes. ashestd.org/herpes/herpes_learn_questions.cfm. familydoctor.org/online/famdu/sen/home/sex-infection/st/091.html. famveer.com/info/living/genital-herpes-sex.jsp. globalherbalsupplies.com/herpes/safe-sex.html. goaskalice.columbia.edu/1237.html. Sex and Huntington's disease. hda.org.uk/download/acrobat/hdafs011.pdf. hdlighthouse.org/treatment-care/care/hdlteriad/exercise/update/0041sex.php, a hormone related to sex can grow a new brain. Sex and irritable bowel syndrome. drcoop.com/nc/93/000246.html. emedicinehealth.com/irritable_bowel_syndrome/article_m.htm. 45% stated that IBS interfered with their sex life. healthandage.com. irritable-bowel-syndrome-symptoms.com/1/does-irritable-bowel-sex-drive.html co.com/global/story.asp?s=1230053 Sex and kidney patients. aaaaq.com/kidney_urologic/sexual_urologic_problems_of_diabetes aakp.org/aakp-library/discussion-of-sex-and-intimacy kidneypatientguide.org.uk/site/sexual.php network17.org/quality/sexuality.htm renalinfo.com/a/n/display/lifestyle/coping-and-living-with-kidney-failure singapore.renalinfo.com Sex and mastectomy. Mastectomy is the surgical removal of one breast or breasts because of breast cancer. They say it doesn't harm sexual functioning, but a lot of women feel unsexy. They can get boob jobs. Sex and multiple sclerosis. byge.com/sexeducation/multiplesclerosis.html nationalmssociety.org/annotated-bib-sexual.asp neuroeducation.org.uk/pages/ms/sex.html thirdage.com/news/archive/0203229-02.html webmd.com/content/article/99/1052554.htm Sex hormones may affect multiple sclerosis. Sex and obsessive compulsive disorder. en.allexperts.com/q/ocd-obsessive-compulsive-3297/ocd-sexual-relationship.htm Sex and spinal cord injury/sex and paralysis. People with spinal cord injuries can get autonomic dysreflexia, a dangerous bodily reaction that can result from sexual activity or using a vibrator. Paraplegic men can't ejaculate because the nerves in the spinal cord responsible for ejaculation have been destroyed, but they can still have children by artificial insemination. The doctor scrapes sperm cells out of the testicles at the base of the penis. sexualhealth.com, sexual health and fertility after brain and spinal cord impairment. sexualhealth.com/channel/view_sub/disability-illness/spinal-cord-injury. ahrq.gov/clinic/epcsum/sexlsbsum.htm, sexuality and reproductive health following spinal cord injury. answers.yahoo.com, having sex with a paraplegic man. cpaont.org/faq/spinal_cord_injury, frequently asked questions, about spinal cord injury. disabled.gr/lib/?p=10492, vibrator helps people with spinal cord injuries. disabum.com/sexuality-the-art-of-the-hyphen-of-hyphen-disability-of-navigate-their-sex-lives. en.allexperts.com/q/spinal-cord-injury-2097/sex-drive.htm nsrc.sfsu.edu, National Sexuality Resource Center, NSRC, User's Guide for the Paralyzed Penis, Sex After Spinal Cord Injury. sexhealthmatters.org/spinal-cord-injury. sexualhealth.com, Spinal cord injury. sexycord.com/paraplegia.html spinalcord.uab.edu/show.asp???DIRKEY=22405, Sexual function for men with spinal cord injury. spinalcord.uab.edu/show.asp??DIRKEY=51275, Sexuality for women with spinal cord injury. spinal-injury.net/sexuality-spinal-cord-injury.htm stanleyducharme.com/resources stanleydusharm.com/resources/sex_spinal cord_injury.htm strangequestions.com/question/609/can-para-p-leg-ics-have-sex.html youtube.com, exploring and empowering sex after spinal cord injury. Chapter 4. Sex Education for Disabled People. Sex education websites for physically and mentally challenged people. aamr.org/content_198.cfm, mental retardation. able2uk.com/sex-education.html. adultsextoysuk.wordpress.com/disabled-people-and-sex. advocatesforyouth.org. autismnow.org. betterhealth.vic.gov.au/bhcv2/page/sex_for children_for-tips_for parents. bettersex.com/adult-sex-education/sex-books/sp-love-and-disabilities-for-people-with-hyphen-sex-for-with-hyphen-disabilities-for disabilityLiving.ca/sex-and-disabled-children-need-sex-education. disabilitytraining.com. disabled-world.com/disability/sexuality. en.wikipedia.org/wiki/the_abc_of_sex_education_for_trainables, a 1975 short educational film hosted by Richard Dix. eric.ed.gov, sex education programs for people with intellectual disability, how effective are they? fem-blog.tumblr.com/posts/28835371765/sex-for-youth-w-disability. hoagiesgifted.org/eric/faq/sex-ed.html. instituteforsuality.com, sex education for the mentally handicapped. myhandicap.com/sexual-assistance-disability.html. mypleasure.com/education/disability/index.asp. mypleasure.com/education/sex/and_toys_and_disabilities.asp. scarletine.com. sexsmart-films.com/free-videos/sex-abled-disability-uncensored. sexsupport.org, sexuality and disability, education, advocacy, and support. sexsupport.org/sex.html. sexualhealthanddisabilities.com. Sex education websites for mentally challenged children. advocates4youth.org/publication/frtp/challengedouth.htm, sex education for physically, emotionally, and mentally challenged children. sexuality-do.ca/teachers/teaching-sex-ed-for-youth-with-intellectual-disabilities. stanfield.com/teaching-the-mentally-retarded.html. Stanfield's Life Facts is a 7-volume slide presentation series that helps mentally retarded students understand basic sex education and social skills. video.google.com. The ABC of Sex Education for Trainables is a 1975 short film created by Planned Parenthood. Chapter 5. Sex and Disability Resource Information. Sex and Disability Organizations. I heard a radio show that talked about several organizations that try to help people with disabilities with sex in 2 main ways. Educate their caregivers that they are sexual and it must be addressed if it comes up in conversation. Disabled people want sexual surrogates. The groups were Equal Rights for Sexual Expression, Canada. The TLC Trust for Britain. They mentioned a group for Australian disabled people to get sexual surrogates. There is a group for Denmark. Send me sex and disability organization websites so I can put them in this book. outsiders.org.uk. Sex disability websites 1. Try hashtag 613.950, hashtag 613.9608 or HQ54.2 and RC108 at the library for books about sex instruction for disabled people. Sexualityandisability.org. Outsiders.org.uk, Outsiders Club, Sex and Disability. Scarletine.com/article/no_big_deal_sex_disability, no big deal. Shada.org.uk, Sexual Health and Disability Alliance. thesite.org/sex and relationships/having sex/sex and disability, sex and disability articles, the site. tlc-trust.org.uk, the TLC Trust. venusenvy.ca/sex-toys-and-disabilities, sex toys and disabilities, Venus Envy. Sex disability websites 2. AACsafeguarding.ca, the Speak Up project gives people who use augmentative and alternative communication, AAC, the words and pictures they need in order to communicate about and express their sexuality. abledata.com. accessibility.com.au/news/articles/part1_sex.htm. achievable.concepts.com.au, 03-987-30182, products for disabled people. advocacicenter.com, abuse of people with disabilities. aidsmap.com, sex and AIDS. audiacitymagazine.com, love and disabled people. bccpd.bc.ca/wdi/sex_dis.html, sexuality and disability webliography. BC Coalition of People with Disabilities. bcm.edu/crowd/health_wellness/health_wellness.html, health and wellness for women with disabilities, Center for Research on Women with Disabilities. bcm.edu/crowd/national_study/sexfunc.htm, Women with Disabilities. bcm.edu/crowd/national_study/sexinfo.htm. Study of women with physical disabilities. beautyability.com/sex.htm. byge.com/sexeducation/disabilities.html. blindcanadians.ca/publications/cbm/17/exploding-myths-about-disabled-everyone-else-documentary, exploding myths about sexuality. cafamily.org.uk, sex and relationship education for young people with physical disabilities, a booklet for teachers. cardiacrehabilitation.ca/documents/sexual activity. cdadc.com/ds/sedref1.htm, sex education for people with disabilities. cfsh.ca/sexual_health_lnfo/sexuality-and-disability. charismamag.com/life/1487-2-love-marriage-and-disability, love, marriage, and disability. clayspress.com, the ultimate guide to sex and disability for all of us who live with disabilities. comeasyouare.com/sex_and_disability. curbcut.com, sex icon. cysticfibrosis.page.asp?id=67, Canadian Cystic Fibrosis Foundation Sexuality and Cystic Fibrosis. disabilityresources.org/sex.html. ehow.com, what to do when chronic illness affects your sex life. en.wikipedia.org/wiki/sex_and_illness. livestrong.com, sex and illness. scarletine.com/tag/infection. sextoytesters.co.uk/com rediscovering-sex-after-disability.shtml. sexualhealth.com, disability and sexuality information. sexualhealth.com/channel.php?action=view&channel=3 Sexuality and disability or illness, sex information education. Sexualhealth.com/sex-and-chronic-diseases-disabilities-chronic-conditions. Voices.yahoo.com, marriage and chronic illness. wiki.answers.com/q/can_you_have_sex_while_sick, can you have sex while sick? Sex disability websites. 3. Disabilities-r-us.com, Disabilities Are Us. Disability and Sexuality.abilities.ca. Disability.com. disability.vic.gov.au/dsonline/dsarticles.nsf/pages/disability and sexual issues, open document. disabilityexchange.org. disabilitynow.org.uk/time to talk sex. disabilityresources.org/sex.html. disabilityworld.org/0304_01/art/sexuality.shtml, mental orgasm. disabilityworld.org/0608_04/il/sex.shtml. disableddating.com. disabledparents.net. disabled-world.com. disabled-world.com/artman/publish/sex-positions.shtml. disabled-world.com/communication/disabled-dating. disabled-world.com/disabled-dating. disaboom.com/disability-dating-and-general/seeing-beyond-disability-to-love. disaboom.com/sexuality-and-disability. kinseyinstitute.org/resources/sexlinks.html. lookingglass.org. loverollson.wordpress.com, unlikely tales of marriage, love, and disability. loverollson.wordpress.com/tag/disability-and-sex. mainstream-mag.com/gimpsex.html. newmobility.com. Sex disability websites. 4. Outsiders.org.uk. Outsiders is a community of disabled people who work together to campaign for the acceptance of disabled people as sexual partners. pacificnews.org/marco/sex-surrogate.html, disability and sexual surrogacy. paralinks.net/paralinksarchive/graceofmyheart.html. paralinks.net/sexualitysi.html. pdassociation.com, disability training videos and resources. fpo.cdc.gov/phtn/sprev/disability.pdf #search =sex disabilities, sexual assault against people with disabilities. ppsr.com/sex_silicon_and_polio_survivors.html. primenet.com/lathrop/gimp. psychologytoday.com/blog/aspergers-diary/2012001/love-identity-and-disability. quadjoy.com, mouse for quadruplex, etc. qualitymall.org/products/prod5.asp?prod_905. queersonwheels.com, LGBTQ with physical disabilities. rocklaw.lexipal.com/article/14511. scarletine.com, no big deal, sex and disability. scisexualhealth.com. sesa.org/newsltr/ref_sexuality/sli11.html, sexuality in Down syndrome. sexsupport.org. cqc.state.ny.us/hot topics/sexhot.htm, sexuality and people with mental. sexualhealth.com/channel/view/disability-illness. Sex disability websites. 5. sexuallyable.wordpress.com. scisexualhealth.com. sfc.org.uk/adult/issue02/15 disabel.htm, sex trade work and disability. sieccan.org, Sex Information Canada. siecus.org, Sex Information and Education Council of the U.S. siecus.org/pub/biblio/bibs0009.html, Sex and Disability Bibliography. spinalcord.uab.edu/show.asp?durkey1/424434, information about sexuality following spinal cord injury, information about a variety of issues related to spinal cord injury. sxcdc.org/index.php. tash.org/express. thearc.org/faqs/sexlove.html. uic.edu/org/idhd/text version/online events text.htm. un.org/esa/socdev/enable/right/aussie7docs/aussie7fawomen.doc. users.netmatters.co.uk/ju90/sci-life.htm. uwlax.edu/advancement/connect-text/issues/apr3/disabilitiesx.htm. wheelchairuser.info/sex.html. Sexuality Information and Education Council of the United States, SIECUS. 90 John Street. Number 704. New York, New York, 10038. 212-819-9770. siecus.org. Sex and Disabilities/Illness Resources. There is a journal called Sexuality and Disability, link.springer.com/journal/11195. CLISSpress.com sells the book The Ultimate Guide to Sex and Disability by Miriam Kaufman, Corey Silverberg, and Fran Odette. There is a book by Marcia Sipsky and Craig Alexander called Sexual Function in People with Disability and Chronic Illness. Sexuality Information and Education Council of the United States, SIECUS. 90 John Street. Number 704. New York, New York, 10038. 212-819-9770. siecus.org. American Paralysis Association. Spinal Cord Injury Hotline. 500 Morris Avenue, Springfield, New Jersey, 07081. 800-225-0292. 800-526-3456. 973-379-2690. Fax, 973-912-9433. paralysis@aol.com. apacure.org. Arkansas Spinal Cord Commission. 1501 N University. Number 400. Little Rock, Arkansas, 72207. 501-296-1788. Ask about info about sexuality for spinal cord patients. Arthritis Foundation. 1330 Peach Street, Atlanta, Georgia, 30309. 800-283-7800. 800-479-5044. 800-285-7800. 800-960-7682. 404-872-7100. Arthritis.org. Free booklet about sex and arthritis. Autism Society of America. 7910 Woodmont Avenue. Number 650. Bethesda, Maryland, 20814. 800-3 Autism. 301-657-0881. 301-565-0433. Fax, 301-565-0834. Autism-society.org. Booklet Sex Education Issues for Persons with Autism. Coalition on Sexuality and Disability. 132 East 23rd Street. Number 109. NYC 10010. 212-242-3900. Committee on Sexuality. Advocating for people with developmental disabilities. 21450 Bear Creek Road, Los Gatos, California 95030. w3ddesign.com/committee. Connections. Newsletter for the National Center for Youth with Disabilities. Box 721. University of MN Hospital and Clinic. Harvard St. River RD. Minneapolis, Minnesota 55455. 800-333-6293. Diverse City Press. 33 de Fleur Alleys, Eastman, PQ Joe Wunpo, Canada. 450-297-3080. Diverse-city.com. Educational materials for people with developmental disabilities. Gay and lesbians with disabilities. 020-7688-4111. Regard.dircon.co.uk. Handicap introductions. Computer matching. 35, Wisconsin Circle. Number 205. Chevy Chase, Maryland 20815. 301-656-8723. Illinois Department of Rehabilitation Services. Office of Public Affairs. 623 East Adams Street. POG 19429. Springfield, Illinois 62794. 800-843-6154. 800-223 dial. 217-782-5734, TDD. State.il.us. Ask for free article Sexuality and Disability. Information Center for Individuals with Disabilities. FT. Point PL. First FL. 27-43 Wormwood ST. Boston, Massachusetts 02210-1606. 800-462-5015. Kessler Institute for Rehabilitation Incorporated. 1199 Pleasant Valley Way, West Orange, New Jersey 07052. 800-435-8866. Video and other materials in their education department. Sexuality Reborn, Sexuality Following Spinal Cord Injury. Kluwer Academic. Plenum Publishers. 233 Spring Street, NYC 10013-1578. 800-221-9369. 212-620-8000. PLenum.com. Sexuality and Disability Journal. National Center for Youth with Disabilities. 800-333-6293. Booklet Issues in Sexuality for Adolescents with Chronic Illnesses and Disabilities. National Clearinghouse on Women and Girls with Disabilities. Educational Equity Concepts Incorporated. 114 East 32nd Street, NYC 10016. 212-725-1803. National Information Center for Children and Youth with Disabilities. POG 1492. Washington, D.C. 20013. 800-999-5599. 800-695-0285. 800-695-0285, TDD. 202-884-8200. Fax, 202-884-8441. nickhsci@aed.org. nickhsci.org. Booklet Sexuality Education for Children and Youth with Disabilities. National Organization on Disability. 800-248-ABLE. NOD.org. National Rehabilitation Center. 8455 Colesville Road, number 935. Silver Spring, Maryland 20910. 0216. 800-346-2742. 301-588-9284. abledata.com. Major source of info. National Rehabilitation Information Center. 8455 Colesville Road. Number 935. Silver Spring, Maryland 20910. 834 Narek. 800-346-2742. 800-227-0216, TTY. 301-588-9284. narisi.com. National Spinal Cord Injury Association. 8300 Colesville Road. Number 551. Silver Spring, Maryland 20910. 800-962-9629. Ask for info about sex and disability. National Task Force on Sexuality and Disability. University Hospital. 75 East Newton Street. Boston, Massachusetts 02118. Outsiders, UK. Social Organization for People with a Disability. POG 4ZB. London W1A4ZB. England. 020-8220-5949. 171-739-0388. Fax, 171-739-0355. Outsiders.org.uk. British group for people with disabilities interested in sex. People First Programme. 9227 6414, Perth. 08-9841 4035, Albany. fpwa-health.org.au. Aimed at people with mental disabilities. Planned Parenthood Federation. 810 7th Avenue. NYC 10019. 212-541-7800. 800-829. 800-230 Plan. 888-755. PlannedParenthood.org. ppfa.org. Brochures: Contraceptive Services for Disabled People, Sex Education for Disabled People and Table Manners, a Guide to Pelvic Examinations for Women with Disabilities. Project on Women and Disabilities. 1 Ashburton Place. Number 1305. Boston, Massachusetts 02108. 800-322-2020. 617-727-7440. Psych Ed Corp. 1170 Commonwealth Avenue. 3rd FL. Boston, Massachusetts 02134-9942. 800-852-2884. Book Exceptional Parents, Guide for Active Adults with Disabilities. Sexual Health Network. 1 Tamarack Ridge Circle. Huntington, Connecticut 06484. 203-924-4623. Sexualhealth.com. Sex and Disabilities Information. Sexuality and Disability Training Center. Boston U Medical Center. 720 Harrison Avenue. Number 906. Boston, Massachusetts 02118. 617-638-7358. Sexuality and Disability Journal. Sexual and Personal Relationships of People with Disabilities, /SPOD. 02760799191. spod-uk.org. Through the Looking Glass. 2198 6th Street. Number 100. Berkeley, California 94710. 800-644-2666. lookingglass.org. Information. University of Michigan. Sex and Disability Unit. Box 33 #E3254. University Hospital. Ann Arbor, Michigan 48109. 313-764-5335. Michigan.edu. Chapter 6. Disability Resources. Major disability websites. Books about chronic illness and disability are at hashtag 362.1000-362.4083, HV888, HV3011, or RJ108, RJ380 at the library. AAPD.com, 800-840-8844, American Association of People with Disabilities. DisabilityInfo.gov. Ability.org, Disabilities UK. AbilityOnline.org. AbleLink.org. aspi.hhs.gov/daldcp/home.shtml, Disability, Aging and Long-Term Care. Benefits. See heccup.org, a service of the National Council on Aging, helps people connect to private or government programs. CareYellow.com, Care Yellow pages. Charity.com/charities/disabilities/index.html. Chebucto.ns.ca/tilde-af380/newsgroups.html, IRC, mailing lists and newsgroups for those needing support. cire.buffalo.edu/directory, disability research centers, agencies. Cody.buffalo.edu, Cody, cornucopia of disability information. Deafblind.com/search.html, search engine is accessible to people using adaptive equipment. Disabilityistoday.com. Disability.com. Disability.gov. ilo.org/public/english/support/lib/resource/subject/disability.htm, Disability, Resource Guide. Disability.gov, designed to be a one-stop information source, this site offers users information on the wide range of U.S. federal programs, services, and resources available to Americans with disabilities and their families. Disability.gov.uk. Disability.ucdavis.edu. Disability-abuse.com, how disabled people get abused. Disabilityaction.in-sa.com.au, disabilities in Australia. Disabilitygrapevine.com. Disabilityhelpsite.com. Disabilityinfo.gov. Disabilitymuseum.org. Disabilitynet.co.uk. Disabilityonline.com. Disabilityresource.com. Disability-resource.com. Ataccess.org, Technology Access. Disabilityresources.org, DRM Guide to Disability Resources on the Internet. Disabilitysolutions.org. Disabilitytraining.org. Disabilityworld.org. Disabledworld.com. Disaboom.com. Disaboom.com/resources, disability organizations. DISDHIS.com. dole.gov/idip/www.dole.gov/idip, Office of Disability Employment Policy. easter-seals.org/resources/educatio.asp, Easter Seals, education about specific disabilities. ed.gov/about/offices/lists/OSERS/NIDRR, National Institute on Disability and Rehabilitation Research. ed.gov/about/offices/lists/OSERS/NIDRR, NIDRR, National Institute on Disability and Rehabilitation Research. esmerl.org/forum/news.htm. familyvillage.wisc.edu. familyvillage.wisc.edu/index.html, Family Village. Icon.com, the Icon Conditions Library includes information on the causes, incidence, prevention, and treatment of various disabilities and conditions. icdi.wvu.edu/others.htm. iii.org/individual/other/insurance/household help, eligibility for help through insurance. ldonline.org, LD Online. Learning disabilities. macoa.org, disability resources. medlineplus.nlm.nih.gov/medlineplus/disabilities.html musa.org/ncde, National Clearinghouse on Disability and Exchange, Mobility International. mosresuRCEnet.org/factscheet.htm, Mos Rehab Disability Fact Sheets. mosresuRCEnet.org/resources.htm. nasi.org/home.html, Home Care/Hospice Locator. ncd.gov, National Council on Disability. ncddr.org, National Center for the Dissemination of Disability Research. newmobility.com, New Mobility Magazine, a resource serving the informational needs of people with disabilities. nichsci.org. nichsci.org, National Dissemination Center for Children with Disabilities. nichsci.org/disabinf.asp, NICHSI fact sheets on specific disabilities. nichsci.org/pages/home.aspx, disability fact sheets. nichsci.org/pages/state-specific-info.aspx, disability resources for each state. nih.gov/health/infoline.htm, NIH toll-free information hotlines by condition. planetaember.com, Health, Medical, and Disability Resource Center. adainsights.org/disability.html. planetmobility.com. rehabchicago.org/community/glossary.php, Rehabilitation Institute of Chicago's glossary gives concise definitions of some important disability-related terms. specialneeds.com/books.asp, America's Disability Bookstore. ssa.gov/disability research. surfwax.com/disabilities. thearc.org/related-links.htm, disability-related sites on the World Wide Web. topdisabilitywebsites.com. trace.wisc.edu/tcel, Cooperative Electronic Library, selected disability documents and resources. ucp.org/ucp_local.cfm, the world's premier gateway to disability resources on the Internet. ultimatedisabilityguide.com, disabilitylawyers.com. vanderbilt.edu/Kennedy, JFK Center for Research on Human Development, tips for parents, teachers, and others who work with children and adults with disabilities. wapd.org, World Association of Persons with Disabilities. webable.com/websites.html. yahoo.com/society_and_culture/disabilities/organizations. Office of Special Education and Rehabilitative Services. U.S. Department of Education. 400 Maryland Avenue SW. Washington, D.C. 20202-7100. 202-245-7468. ed.gov/about/offices/lists/ozers. The Family Village. Waisman Center. University of Wisconsin-Madison. 1500 Highland Avenue. Madison, Wisconsin 53705-2280. Family Village at waisman.wisc.edu. familyvillage.wisc.edu. The Family Village website is an attempt to bring together valuable information for parents of individuals who have disabilities. National Organization on Disability. 888 16th Street Northwest Suite 800. Washington, D.C. 20006. 202-293-5960. Fax, 202-293-7999. TTY, 202-293-5968. NOD.org. National Organization on Disability. 5 East 86th Street. New York, New York 10028. 646-505-1191. Fax, 646-505-1184. NOD.org. Disability Websites 1. Disability.gov, disability.gov. 3lbdogs.com/about/mybooklet.html, aadb.org, aaes.org, Access Engineering Specialists, aaos.org, American Academy of Orthopedic Surgeons, aapd.com, 800-840-8844, American Association of People with Disabilities, aapd-dc.org, American Association of People with Disabilities, nonprofit cross-disability organization of people with disabilities, aapd-dc.org, American Association of Persons with Disabilities, aarp.org, AARP, abanit.org/disability, mental, physical disability law, abilities.ca, abilitiesexpo.com, abilitiesfestival.org, ability.org, Disabilities UK, abilityawareness.org, Ability Awareness, House Building Project, abilitybeyonddisability.org, abilitycamp.com, Ability Camp, Children with Physical Disabilities, abilitycenter.com, Ability, abilityhub.com, abilityhub.com, Information concerning assistive technology, abilityinfo.com, Disability News Ticker, abilitymagazine.com, dedicated to enhancing the quality of life for people with disabilities through housing, education, employment, media, and volunteer opportunities, abilityonline.org, abledata.com, AbleData, the National Database of Assistive Technology Information, able-ezine.com, ablelink.org, Ability Online Support Network, family-friendly online environment, ablelink.org, Ability Online, a computer network designed to enhance the lives of children and youth with disabilities or illness by providing an online community of friendship and support, ablenews.com, an established publication in the disability community, a monthly newspaper, ableproject.org, Able Project, abletowork.org, Able to Work Consortium, about-cerebral-palsy.org, aboutonehandtyping.com, academic.questa.edu/acasup/dsp/1disabil.htm, accentonliving.com, access-auditing.com, Disability Discrimination Act Access Audit Service from Disabled People, access-board.gov, US federal agency website committed to accessible design. Includes a useful links section. accessdome.com, accessdome.org, accessibilidade.net. Disability websites too. accessible.org, accessible website resources serving people with disabilities. accessiblesociety.org, Center for an Accessible Society. accessiblespace.org, Accessible Space Inc. accesslife.com, accessliving.org, Access Living, accesstravelcenter.com, accessunlimited.com, aclu.org, info on the rights of disabled people, activelight.com, act4live@aol.com, magazine, ada.gov, Americans with Disabilities Act, adaindiana.org, adonet.org, American Disability Association, adapt.org, American Disabled for Attendant Programs Today, information on alternatives to nursing home care, adapt-ability.org, adaptnv.org, book about adapting home for disability, adaptivetech.net, adata.org, technical assistance for the ADA, adata.org/dbtac, 800-949-4232, ADA Disability and Technical Assistance Centers, adawatch.org, addedreality.com, attitudemag.com, Attitude Magazine, advokaki.org, advokakiinc.org, aetna.com/group insurance/employers_disability_1.htm, aginginplace.org/laws/resources/major.html, agrabilityproject.org, Agrability, people with disabilities in agriculture. aip.org/ip/ura/disable.html. allabilities.com, disability links for people of all abilities. alpha.acast.nova.edu/diversity.html. als.uiuc.edu/infotech-access. alsigelcenter.org, Rochester, New York, disabilities. alz.org, Alzheimer's Association. amazingkids.org. americasdoctor.com, America's Doctor. ameritech.net/users/frcdptil, Family Resource Center on Disabilities. angelscommunity.com/n/disabilities, Disability Services, Societies wheelchairvanrentals.com/links.html, for rent. annexter.org, Annexter Center. apa.org, 800-374-2721, American Psychological Association. apa.org/pi/cdip, Disability Issues in Psychology. apacure.com, Christopher Reeve Paralysis Foundation. apidisabilities.org/index.html. apparelized.com, Disability Directory and Resources, disabled world.com. apple.com/disability.